Audio Jungle. Audio Jungle. Audio Jungle.
Thank you very much for joining us on another edition of the MedFiles program. I am your host, Marianne Waisha. Now, as usual, this is the one medical program that gives you an opportunity to ask questions that you ordinarily would not be able to ask a doctor or ask a professional. And we get you a doctor or a relevant professional to answer the questions that we have from you for every edition of the MedFiles program. I have in studio Dr. Frederick Kimemia, and we'll be taking the questions that we have from you for this edition. Daktari, karibu sana.
Asante sana.
You were with us last time.
Yes.
We discussed some very interesting, very educative
Yes.
issues, if you ask me, on epilepsy and, you know, conditions that would pose as something else.
Yes, and
Yeah.
especially the most interesting for me was the care for older citizens. For older citizens.
Yeah.
And I think your studio is helping to air out the needs of elderly people in our communities. Yes.
All right. Thank you for that. Thank you for coming once again.
Okay.
This
Welcome.
time we have
Welcome.
questions that appear very basic, but you know, once our audience sees them, we'll be able to get why they're basic, but also very important
Yes.
for you to answer.
Yes.
Okay, let's take the first one. This is the one of the ones that I like I described is you know, very basic
Yes.
on face value. But if somebody posed the question to the ordinary Mwananchi, you'd still, you know, have a question mark. Like, actually, I don't know. The issue of loss of voice.
Yes.
It's very common. You know, I don't think there's anybody
Who's never had
yeah, unless you're very young,
Yeah.
who hasn't experienced this, or at least hasn't dealt with someone or seen someone with this kind of problem. Usually when one has a cold, you know, you find that there are times people will lose their voice and they'll talk, you know, have a hoarse voice, and you'll find, you know, for some people the voice disappears completely so that they seem to be on mute, you know,
Yeah.
and others it's hoarse,
Yes.
and it's painful, and it comes usually with a cold.
Yes.
So that's what this young man is asking
Yes.
about.
Yes.
What causes the loss of the voice?
Yes.
And usually the pain that accompanies
Yes.
it on the throat.
Yes.
Yeah.
We are not able to open up a human being so that you can see what is behind the mouth and the voice box. But there's this small organ we call the voice box, or the voice organ. God created in such a way that if you were to pull it out and look at it, then you would understand why someone loses their voice and they have pain when they have an upper respiratory infection, tract infection. We call it upper respiratory tract infection because it happens within the upper tract. We have the lungs. The lungs is the lower respiratory tract, respiratory tract, and then we have the upper. The upper respiratory tract comprises of the voice box. It goes up to your noses, and there's a small tube that connects the mouth, the upper of the mouth, and the ears. So we have those three organs, and I'm really going to talk a little bit about them as we answer this question. And most importantly, I think I want to start with the voice box. The voice box has some thin membrane like sheets of skin, sheets of skin. We call them membranes. And when someone is talking, and the voice, as you hear the voice, these are movement of the membranes. Then these membranes are that's part of the voice box, and the voice box has other organs around, but the main ones are the membranes. They are sheets, 2 sheets of membranes. What happens when you lose your voice? When you lose your voice, for sure it doesn't come like that. It's usually after a cold,
or during the height of a cold.
The height, or even usually after, when you're right getting the infection the first day and the second day, usually it's very hard. Then it's at the worst on the 3rd day, probably 4th day, up to the 7th day. Most of the infections that we have, and we classify them as flu, they are collections of viral infections. These are viral infections, and they will last up to probably 7th day. Usually you lose your voice the 2nd day, the 3rd day, and probably the 4th day. And the reason that's why you lose your voice, because those 2 membranes, when you have an infection, swell. They swell. Because any infection, like I think we shared this in the previous programs, any infection causes 3, let me say, they're usually 5, but we can talk of 3, which are very common, and you will understand them. One of the things that is a symptom, it's a result of an infection, is 1, pain. If you have an infection somewhere, you will have pain, either on your wound or whatever the infection is. So you'll have pain. That is one of the indication that there is a problem. Yeah. If you have pain somewhere, and in this case it's the voice area, the voice box, you're swallowing, you have a problem because there is pain because there is an infection. So I say pain. The other one is loss of function. When you have pain somewhere, you lose the function of that organ. If you have a pain on your leg or inside your leg in the joint, it means you can't walk well. If you can walk probably, but you will walk with difficulty.
Yeah.
And that's what we call loss of function. So in this case, if you have an infection inside the voice box, you lose the function of that organ.
But should that then explain how one would be able to talk, but it's painful when they talk?
It's painful, but even listen to how they talk.
At all.
Yeah, you listen if you get a call and you have flu, the first thing they will ask you is that you? Because the voice that is coming to them, it's different.
Yeah.
So, and it's different because your voice box is losing some function. There is that swelling. Like I say, there's swelling, and the swelling because of an infection, you will have loss of function. I say loss of function, pain. The other one is the swelling.
Yeah.
The swelling comes from the bacteria and the germs, the bacteria or the fungus or the disease itself. If you have an infection inside the voice box and on the membranes, what happens is that they swell. And when they swell, there will be voice, but that voice will be different from what people are used to. It's like when you tune a guitar. If you relax it a little bit, the voice that comes, it's not the voice that is supposed to be coming. So what happens when you swell, when your membrane swell, the voice will come, yes, but the voice will be different.
It will be different from what we know.
Yeah, from what we know. So you hear people talking in hoarse voice.
Usually deeper.
Yeah, deeper voice, because it's like you move from the higher key
to the
lower key, so you get deep. And even just to play analogy, what happens with boys when they're breaking their voice? You know, when they break the voice, the membranes are the ones that are affected. You know, they become larger. They become larger instead of this high-pitched sound. So you get low-pitched, deep voice. It's a change of the membranes. So
when the voice disappears completely,
yeah.
What has happened in that case with the membrane? Is it that it's so swollen that...
It's very swollen. When we look at those membranes, on our when we're examining patients, usually they are red and very swollen. And when someone is talking, there's supposed to be a gap between the membranes.
I see.
Because what the lungs do is that they push air through the membranes, and what the membranes do, they extend outward and vibrate. They extend outwards so that they can create space for air to come out from the lungs. So when that happens, is that you get people talking, and you know it happens based on our training. So you sort of know if you want to pronounce a word, this is how you move your lungs and the membranes. The body is very intricate and very complicated, so that you can the membranes will move based on the sounds that are supposed to come. So I said 3 signs: the pain,
there's a pain, there's a
swelling, and then there's loss of function. So I will just, in this case, we wanted those 3.
But basically what you're explaining is that when one loses the voice completely, then it means the membranes are so swollen that air cannot pass through.
The air can pass if you force.
And
but you know, when like, and it's usually much worse on ladies, and men will probably struggle and talk. But some who are like, or even we've seen men who are very, like, what is it? Like, the pain is so much so they can't talk. And again, what we advise is that if you have a flu, or if you have a change in the membranes, talking and singing makes it worse. Because the membranes are still moving. So we try to ask you relax, and that's why you see even people being given sick off. So that if your job is talking, if you're a teacher, then you have a sick off, the membranes are not going to work hard. And if they're not going to be strained, so it means that you can heal faster, yeah. Because the more you disturb the membranes, the more you have repeated infections. We've seen changes. Complete, like people lose their voice completely. And even when our patients, like when people have cancer of the larynx and the voice box, you know those membranes could be tampered, could be changed forever, and some have lost their voices. They have to go for retraining, or they get an external voice box that could the device that could help
them to talk. Okay, interesting as well. Let's
it's
see
very
what
interesting.
What was asked next. Again, a very common observation: nose bleeding. Again, very common. But in terms of explanation, very few of us can, would understand or would be able to explain what's happening when one begins to nosebleed. For most of us, nosebleeding is associated with either a fight, a physical fight like that that would happen when we were young and things like that, or excessive heat.
Yes.
I know there was at some point excessive heat would cause nose bleeding. So those are the 2 that would come to my mind, would be at the top of my mind. But still, in terms of explaining what goes
happens
wrong in the body, a situation like that.
Yeah. And yes, that's a good question. And I think we're getting these questions when it's a cold season. So most of these patients, our viewers probably are going through these things on a daily basis, but also one of our role is to educate the public about the health issues, especially those who cannot be able to visit a doctor. Maybe they are in very far areas, or maybe you visit a doctor but you didn't get adequate information. So thank you again for bringing this question, because it looks basic, but it's not basic. Especially if you look at the teachers who are dealing with young children, if you look at parents who are again having children at home, in most cases they don't know what to do when a child or probably an elderly person in the street has nose bleeding. So like I probably start with causes. Or maybe before I go to causes, let's see what happens. Because some people think that this blood is coming from the mouth all the
Or
stomach,
from the nose.
all the brain.
Yeah.
But behind the nose, on top, on the roof of the nose, behind it, there's a curve that is there that empties into the mouth, the back of the mouth, and goes to the larynx, the voice box that we just talked about. So that roof has a lot of vessels, blood vessels. And these blood vessels are mostly arteries. Arteries are the vessels that carry blood from the heart. So usually the blood that comes from the heart goes to the arteries. So there are so many arteries and vessels. I'm calling them vessels behind the back of the nose. And they have a lot of blood. There's a lot of fresh blood. The reason God created us that way is so that this area picks a lot of infections. If you smell, every time you smell, air gets inside. There are like thousands of bacteria or fungus or germs in the air. Could be TB, could be pneumonia, could be flu, could be anything. But usually these are those bacteria or germs that are carried through air, because this is air from outside. So what that area does is it has a lot of mucus, it has blood, so it traps all those and kills most of them. So if you have a simple flu getting in, a simple virus getting inside, or bacteria getting inside, and you have immunity, good immunity, so the top of that nose can kill, because there is a lot of vessels, there are a lot of mucus. So physically it traps, that area traps, mechanically, physically it traps germs, but also it has mucus that kills them. So what happens is that when a nose bleeding happens, that roof sort of crumbles. Then you have fresh blood coming from there. And this is blood that is coming from the body through the arteries that are there. So that blood doesn't come from the brain, it doesn't come from the mouth, it doesn't come from the larynx, it comes from that roof. And and like I say, there are a lot of vessels around. And we see it, it's quite common when someone has an episode of flu, because that area was very active. It had blood in it, a lot of blood. Because if you have flu, what happens is that a lot of blood is sent there, because that's how body kills germs. It sends fresh blood. And this blood comes with antibodies or army that helps kill the germs. So there's a lot of blood there, and there's what we call the blood is able to pass in because the antibodies, the ones that kill germs, are in the blood. They're able to pass in and come to the roof of the mouth. So after a flu, after a respiratory infection, some people have nose bleeding, or during when they have flu, because there's a lot of blood around that area. In the incident of physical trauma, huge physical trauma, like a heat, someone hits you like a blow can push you to nosebleed, or a fall. A fall that pushes blood around that area.
So basically, it's the vessels around the roof that you're describing that are either break or rupture.
Yeah, they rupture. They rupture, or they break. They break. And if you there is a lot of mucus around, then you sneeze. Either you sneeze or you blow your nose
too hard.
You blow your nose too hard.
Then
you're going
rupture.
to push pressure around that area. Then they rupture.
So basically, all these causes, be it a blow, be it a flu, be it excessive heat,
yes,
all of those things are things that cause these vessels to rupture.
Yes.
Yeah. So nosebleeding, from my understanding, in all the years that I've heard about it, it's never really been considered a serious thing. If you're nosebleeding, first perhaps you could tell us a bit of, what the first aid is.
Yes.
What should one do? But then also the questions of when do you worry about a nosebleed? When do you dismiss it and say, oh, it's just because, I've had a cold, or it's just
Yeah.
because I've been in the heat for
Yeah.
long?
Mm-hmm.
And when do you dismiss it?
Other than that, because I think what viewers are asking, why do I bleed quite often and my neighbor or my brother doesn't
Yeah.
bleed as much? We've also seen people who have higher chances
Yes.
of nose bleeding. And not just nose bleeding, bleeding from any other area. And it's usually, there are people with weak, there's something we call
vessels.
coagulation factor. Coagulation factor it's a component within our blood and in our makeup, or genetic makeup, that sends the messages that there is a break somewhere of the skin and the vessel. So they send specific blood cells to go and clot, make a clot, and then it stops, and then it stops. So there are people we've seen who have a weak coagulation factor, so that when there's a break, a small break, it's very hard for them to stop the bleeding. And the way, again, God made us is that your body can be able to stop bleeding even without any intervention, the way God created us. So that is not possible. So even those people with weak anticoagulation factor, where we have so many vessels, they tend to get, the vessels tend to break faster.
They have weak vessels as
Yeah,
well.
the weak vessels tend to break faster because, again, the blood itself is not able to control itself. And it's even associated, in some extent is associated to the level of vitamin K. Vitamin K has been known to help the body to make the coagulation factor. So it's like the raw product for the coagulation factor, vitamin K. And probably our viewers have gone to the hospital, and when they're nose bleeding or they're bleeding from elsewhere, they are injected with vitamin K. So sort of like to boost the body to make the coagulation, to helping with the coagulation. So what we're saying is that if you have that as background, if you have deficiency of vitamin K, your coagulation factor is low, and then you have a blow, definitely you're going to
have a big problem.
or maybe a cut, especially with the coagulation factor. If you have a cut elsewhere, you're going to bleed
For long.
So, and then that's why we're saying society needs to understand that any bleeding, either nose bleeding or any other bleeding, we need to empower people to have first aid skills, because these people bleed not within the hospital vicinity, but they will bleed in the community, either through games, when they're doing games and when they're at home. And what we advise is that we need to control the bleeding by applying pressure where there is bleeding. If it's the nose, what you could do, because like I said, it's happening behind the nose.
Yeah.
It's not here on top, because I see people pinching the nose.
I've seen people saying,
that actually can't help. I'm sorry, that cannot help, because the bleeding is coming from behind the nose.
So it's not coming. Okay, that's the school of thought that says it's coming from the brain.
No.
That's why you hold
So
up
then
here.
you hold down. That doesn't help. And the unfortunate thing is that if you try to do that, is that even if you could block even the bleeding of this client, so that they don't bleed well, or even the bleeding could continue and the blood flows behind the nose, and it could go to the lungs, the larynx and the voice box. So that doesn't actually help. That actually doesn't help. We advise teachers and first aiders to be able to understand that usually that place needs like cold, very extreme cold appliances. It could be like you get
Cold
a
wet cloth or
cold
something like
cold wet cloth, not a hot. A warm or a hot one will increase the bleeding. So
you need
because
something
you
cold.
need something cold that can be able to
That
be placed on top
on
of
the
the
nose.
of the nose, so that the extremes, so that behind the nose, you're able to achieve very cool temperatures around the nose. So that can help. But also, we are also advised, if someone is at the if you know where the heart is, like, and the blood is still being pushed up by the heart. So with lying low, we advise
Lie flat on the
we
back.
advise, if a child is not breathing, just let them lie low, and you put a cloth that has very cold water. It could be cold water or ice cold water from the fridge, and then you let the lungs to cool. Usually, most nose bleeding will stop within 3 or 4 minutes if you rest this child. But if you're moving this child up and about, you're increasing the heart
rate.
to
I
pump
see. So you're trying to get the heart rate to be as minimal.
so that it's not
possible.
pushing the blood a lot with much pressure, because the more you push the blood, the more it pushes it through the breakages.
Through the breakages.
Yeah.
And when you say lie low, you mean lie flat?
Lie
on
flat,
the back.
lie flat, and the position we advise is left lateral. Left lateral means that you lie on your left.
Oh, okay.
Lie
so
on
one
your
would
left.
lie,
Lie on your left,
let's
because
say
again the heart will not need to pump a lot. But also, even lying low and lying on your left means that if there is blood that is coming from the nose, the blood is going to come out. The best thing is to have this blood come out, not to remain
not try
inside.
and block it. So
Not
they,
trying,
yeah,
not
okay.
to try
That's
to
another
block
thing,
it,
I think.
and not to put things inside.
Ah,
Because I've seen
I've seen
people who thought they were helping by putting pieces of clothes inside the nose. Because if you pack it, it means that you're not going to help the blood to clot on its own. What we're doing by placing something is to help the blood to clot on its own. Right?
I see.
Yeah.
So it's usually a normal thing. So is the frequency a factor when you're talking
Yeah.
about when to worry about?
Yeah,
nose
frequency
bleeding?
is a factor. Like for young children or guys, in the young people who are in sports, if they have nose bleeding once in a while, that's not a problem. But if someone has repeated episodes of nose bleeding, like every week or something, or probably the blood is a lot, they can't. The bleeding cannot stop. Even with providing those measures, the best thing is to have them checked. Like I said, if the problem is the coagulation factor,
Then it
the
can be
level
dealt with.
that could be dealt with medically. Yeah.
Okay.
But we also advise people to take enough vitamins.
Vitamin K.
Vitamins. But vitamin K is one that is specific for this.
Okay.
Like, it's very hard for you to get a carrot or any other and isolate vitamin K and then just take vitamin K. Yeah.
So vitamins in general.
Because even vitamins, the blood itself, the coagulation, anticoagulation and coagulation factor, you require proteins. So if you just take vitamins and then you don't have, vitamin will help, but the base, the most important aspect of the nutrition is the protein.
Okay. Right. Let's see the last one for today. Okay, like we keep saying, you know,
Yeah.
we make we make a joke every time we get a question that has to do with cancer. Well, it's, you know, we make jokes about it, but it is, I think, a good thing that,
Yes.
you know, it does really reflect how big an issue,
Yes, it
how
is.
big a problem cancer has become in our
Yes.
society. So we keep saying, you know, we'll never do more than 2 shows without a question on cancer
Yeah,
rising.
yeah,
And
yeah.
here we have one before us
Yeah.
again.
And especially cancer in women.
Yes, especially cancer in women.
Yes.
And I think this one is also a bit different because it's a question about cancer in women asked by a man.
Yes.
You know, he asks an interesting question because he says, you know, we've been told, we've got a lot of education and a lot of programming that we have in the media today about cancer. And the one thing that is emphasized is that early detection,
Yes.
you know,
Yes.
it's very important. Early detection saves lives. So he says, you know, just to quote him, he says, wanawake wameambiwa wajitokeze mapema,
Yes.
you know, for testing, you know, go for testing early. And that could be what saves a life. Yeah. So he asks, as much as women are being asked to go for early testing, are there things that an individual woman can do herself
Yes.
to help herself,
Yes,
so
yes.
to speak? And the most common one I know of is a breast exam. You know,
Yes.
there's what we call the self-breast exam, which
Yes.
women are taught to do.
Yes.
Are there others like that?
Yeah, I'm excited because then we're going back to women health, which for me is top, is my passion in life. Because again, about 80% of the health conditions affect women.